All right, so some notes about the GU stuff I posted. Know your anatomy. Know that you have two kidneys that lead to ureters, that lead to a bladder, that lead to a urethra. The bladder has a muscle called the detrusor muscle that's supposed to help squeeze out urine when we need to urinate. Know the anatomy of a nephron as well. So we have the afferent and efferent arterioles. Again, afferent means going towards something, efferent means going away from something. In this case, we're going toward the glomerulus, which is a bundle of blood vessels that we're filtering. The afferent blood vessels carry that dirty blood, and it gets filtered in the glomerulus, and it leaves in the efferent vessels as clean blood. The glomerulus is covered by what's called Bowman's capsule, which leads to the proximal convoluted tubule, lip of Henle, and then distal tubule, and then the collecting duct, which starts to collect the urine, which eventually will lead to the ureters. The hormones, renin is part of the RAS system. Its job is to help increase our blood pressure if our blood pressure is dropping. EPO, erythropoietin, makes red blood cells. If we lack EPO or red blood cells, or we might have anemia in our clients. Calcitriol helps us absorb calcium by creating vitamin D, activating vitamin D. And those three hormones are secreted by the kidney itself. But other important hormones include aldosterone and ADH, which both help to increase our blood pressure in different ways. At the very top, you can see aldosterone again, but another hormone called ANP, atrial natriuretic peptide, which is the opposite of aldosterone. ANP's job is to bring our blood pressure down if we have too much fluid in the body, and the heart secretes that. Know your renal function tests, know the values for them. Know that if we have poor renal function, we could have a buildup of waste products in our blood. Terms like azotemia or uremia for those buildup of waste products. Know the kidney stones. Most common are calcium stones, especially calcium oxalate stones. So we might have our clients avoid certain foods that contain oxalates to prevent that. Struvite is associated with infections, so know that. Uric and then cysteine stones. Know the UTI types, so pyelonephritis, or we call it pyelo in the hospital, is the actual kidney being infected. So you can have pain where the kidneys are, in the flank, in the back. And then lower UTI is like cystitis. Cyst means bladder, so bladder infections. Know that cultures take 3 days to come back. So in the meantime, if we suspect a UTI, we might give broad spectrum antibiotics and be more specific when the culture results do come back. Know the 3 kinds of acute kidney injury, AKI. Prerenal is the blood flow going to the kidney is low. In cases like hypovolemia, heart failure even with decreased cardiac output, or shock. Actual kidney damage is intrarenal, so that could be kidney infection, pyelo. It could be reduced blood flow causing tubular necrosis. And then finally, postrenal is any obstructions that could be from kidney stones, but it could also be from things like masses, or for males, an enlarged prostate gland, or cancers even. Know that with AKI, you have, again, elevated kidney function tests because the kidneys are working very hard. And we have also a retention of fluid. So that could be edema or hypertension. And the one thing to remember is that we do not want to give our clients fluid if our kidneys aren't working, because there's no way we can get that fluid out. And then other notes are just miscellaneous stuff I noticed from the practice test and Socratives. So for collecting urinalysis, a UA, we don't want to connect the initial urine. We want to let them pee first for a bit and then collect the urine that comes after to avoid contamination. I know that about a quarter of our cardiac output goes toward the kidneys, so they're very important. And the rest, I wouldn't worry about too much, but it's there in the secretives and stuff.